Alright guys, so real quickly I just wanted to show you guys what our preference cards look like. Now I don't know if your preference card looks exactly like this, but so far this is my second hospital and they look the same, and I want to show you how you actually read this. Now not all preference cards are perfect and not all of them are the same and updated, you know, because doctors always change their mind at all times. So I'm going to show you exactly how to navigate through this because there's a lot of things going on here. Alright, so obviously I blocked the patient's name because you can't do that. That's HIPAA violation. I'm not trying to get fired. But if you read this very carefully, if you have no idea what's going on or what your case entails or what exactly what you need in your case, I recommend that you resort to reading the preference cards before you ask any other specific questions, because majority of the time you will find something in here that might answer your question. So for example, for me, I always ask myself, okay, what instrument does this surgeon uses and what type of sutures he uses? So I go here under instruments. It says for this second amputation toe, he's gonna need hand tray, core drill, micro 100 with saw blades and K-wires. Now, not all the time you want to open this. Sometimes they're just available, and of course it's not written here, and cases may vary. So what you need to do, you need to ask the question to your nurse if you should open the core drill, because you know a core drill is mostly for like a hallux amputation or something like a bigger bone to cut. We're just doing a second toe, so I'm thinking I should just hold off on that and don't open any blades, because sometimes people don't pick the right blade for the surgeon. So when you open a blade and they don't want it, you just kind of waste some supplies. And for K-wires, now think about that. K-wires are huge, and I know they vary in sizes, but second toe amputation, I don't think I'm gonna need K-wires, right? So, you know, I verified all of this. I went to the podiatry residence and I say, hey, I'm thinking I'm only gonna need a hand tray because, you know, this is only a second toe amputation, right? And they goes, yes, correct. We don't need a core drill. We don't need no saw blades or K-wires. However, if the doctor, the main doctor, because the podiatry residents are just the residents, the doctor might need the core drill for specimen, but don't open it. That's usually how they say it. So in other words, you open the hand tray, have the core drill but don't open it, have some variety of saw blades, and have K-wires just available. Don't open it. And if you do happen to see the surgeon yourself, just ask them yourself what type of saw blades, if indeed he's going to use the core drill. That's it. You just have to communicate with them and see exactly what they need, because I think that shows initiation and assertiveness. If you are a brand new surg tech, I think it's very, very good that you guys ask, because, you know, I've been there, I've done that, and I've learned this. You just have to do it on your own pace, okay? When it comes to sutures, also, now that you're asking already for core drills, you're gonna ask, okay, so are these the types of sutures that you use? If not, you want me to get a suture card? And then they'll just be like, no, I just need like a 4-0 nylon. And then you don't stop there. You ask them, okay, 4-0 nylon, PS2, PS1. Yeah, PS2. Okay, good. That's it. Okay, and then for comments here, it says here, specimen collection, verify the following with Dr. Ramil. Now, some of these comments sometimes don't apply to the whole case, because again, these preference cards are actually made as a mass edit, which means that they probably copied and pasted to all her cases or his cases. So you just gotta like read it, and mostly this is for nurses if it's specimen, or if it has something to do with a comment for a tech or something like that. It'll tell you. For notes, see, it says that's for the nurse. And obviously if you have, it says here, the syringe lower locks and all that, you don't open that to the field, because it says here that the medication is actually off field for residents to use. So, you know, some informations are very informative if you read it. And on top of that, you also look at the equipment here. They're going to use a tourniquet, obviously a Bovie, but tourniquet, sometimes they don't use, sometimes they just use an they use an S mark to use a tourniquet, but sometimes they don't, depending on like if it's just the little toe, they don't use it, but for the hallux they might use it. It just depends. Although, put it in your room and have it available just in case, because you don't want to be running around for equipment when the patient is already there, and you know the scrub tech is scrubbed and we need you and you're over there looking for a tourniquet. So just have it ready just in case. Alright, just go over this quickly. This is for prep. This is where you find the gowns and gloves of the surgeon. These are the drapes, and all of these are going to be picked on your case, but you don't open them necessarily, because you see this, it says available. And this was the blade that I was talking about. So there you go. And here are the sutures. And for dressings, again, you don't open dressings until after the case, because like I said, with podiatry residents, they don't really know exactly what they want. They could be bipolar. They could literally open all of this and use like 3 of each. So you can never, ever tell. So I try not to open any of that. And that's it. If you guys have any questions, concerns, issues, anything, I am open for discussion. For anything that could make my channel any better, please let me know. This is a very constructive criticism type of channel, and we are all here to learn from one another, so I'd appreciate it if you guys let me know. So thank you for subscribing and following my videos. Thank you so much. I really appreciate it, and I hope you guys have a great day.